Hey everybody, my name is Justin Bagley and I'm a physical therapist here in New Jersey, and I am really excited to invite you and your colleagues to this year's APTA New Jersey Spring Conference held at Kean University on April 6th and 7th. So in getting ready for this conference, which I get the honor of presenting at, I've been thinking a lot around this question of if we could redesign healthcare, what would it look like? And it's really an interesting question. And it's a question that I've spent a lot of time thinking about and working on as I've gotten a chance to work in a space that I believe is pretty close to Healthcare 2.0. If I had to list out my list, I'd say, well, you might say it's got to be convenient, right? Much more convenient than the current system is, and it's got to be way more affordable than the current system is, right? I'd also say that it's got to be something that's not so administratively burdensome for the provider. Something that keeps the provider doing what they want to do and what they love to do, and a little less dotting on the I's and crossing of the T's to get paid for it. Right? Wouldn't that be nice? You might say that it has to engage other stakeholders. Things like the communities and the families and the workplaces where we all live, work, and play, since we know the environments have a major impact on our health. And you might say we need to do it with a whole lot more people. Rather than just a one-on-one or a two-on-one type environment, we need to expand that to entire populations. And how do we do that in a realistic way? Right? I would tend to agree. These are all Healthcare 2.0 concepts, some of which those of you who have been practicing in that type of environment for a while would probably call population health. And the good news is that our spring conference this year revolves around population health. So I am really, really excited about it, and I hope you get there so we can talk about these. And so when we talk about the excitement that I have for this, hopefully you have them too, but we really need to think about how we can leverage those ideas to help us navigate from the journey from Healthcare 1.0 to Healthcare 2.0 and hopefully beyond, way beyond. And I hope that there's some folks who may come and join us who have ideas about that. I think it's the kind of thing we need to address, and we need to address it really, really soon. Because if we're ever going to meet our vision of transforming society, if we're ever going to truly improve the human experience, we need a whole lot more people looking at ways to do this. So once again, I'm really excited to invite you and your colleagues and other professionals to our spring conference on April 6th and 7th, again at Kean University. I hope to see you there, and I hope to engage in some really, really awesome conversations with you all. So be there, and we'll do this. Be well, everyone.